Hello everyone. Today we are going to talk on hypertension. Hypertension, also known as high or raised blood pressure, is a condition in which the blood vessels have persistently raised pressure. Blood is carried from the heart to all parts of the body in the vessels. Each time the heart beats, it pumps blood into the vessels. Blood pressure is created by the force of blood pushing against the walls of blood vessels, that is arteries, as it is pumped by the heart. The higher the pressure, the harder the heart has to pump. Hypertension is a serious medical condition and can increase the risk of heart, brain, kidney, and other diseases. It is a major cause of premature death worldwide, with upwards of 1 in 4 men and 1 in 5 women, over a billion people having the condition. The burden of hypertension is felt disproportionately in low and middle income countries where two-thirds of cases are found, largely due to increased risk factors in those populations in recent decades. What are the risk factors for hypertension? There are numbers of risk factors which can lead to increased blood pressure. So these are classified like modifiable and non-modifiable risk factors. So what are the modifiable risk factors? These include unhealthy diets such as excessive consumption of salt, diet high in saturated fat and trans fats, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. Non-modifiable risk factors include a family history of hypertension, age over 65 years, and coexisting diseases such as diabetes or kidney disease. Sign and symptoms. So, hypertension is always a silent killer, as we know. Most of the time, people may not aware that they are having high blood pressure because hypertension in initial stage shows very little or no symptoms. Many people with hypertension do not notice symptoms and may be unaware there is a problem. Symptoms may include early morning headache, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. More severe forms may exhibit fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. If left untreated, hypertension can cause persistent chest pain, also called angina, heart attacks, heart failure, and an irregular heartbeat, which can lead to a sudden death, and which is known as cardiac arrest or sudden cardiac arrest. What are the complications of uncontrolled hypertension? Uncontrolled hypertension causes premature death. It increases the risk of heart attack, stroke, kidney failure, blindness, and other complications. How it affects the other vital organs. Persistent increase in blood pressure causes hemorrhage, stroke, and dementia. Also causes left ventricular hypertrophy, coronary heart diseases, and heart failure. Blindness occurs due to retinopathy, peripheral vascular diseases, and renal failure. Hypertension can cause serious damage to the heart. Excessive pressure can harden arteries, decreasing the flow of blood and oxygen to the heart. This elevated pressure and reduced blood flow can cause chest pain, also called angina, heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cells die from lack of oxygen. The longer the blood flow is blocked, the greater the damage to the heart. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital organs. Irregular heartbeat, which can lead to a sudden death. Hypertension can also burst or block arteries that supply blood and oxygen to the brain, causing a stroke. In addition, hypertension can cause kidney damage, leading to kidney failure. The most important thing is we can prevent hypertension. So, how to prevent? First and foremost is the maintaining a healthy body weight. When it comes to hypertension prevention, your weight is crucial. People who are overweight should try to lose weight, and people of normal weight should avoid adding on any pounds. If you are carrying extra weight or have a body mass index, that is BMI, of 25 or higher, losing as little as 10 pounds can help prevent high blood pressure, according to the American Heart Association. Next is eating a balanced diet. Eating healthful foods can help keep your blood pressure under control. Get plenty of fruits and vegetables and limit your intake of saturated fat, trans fat, and sugar. Consider following the dietary approaches to stop hypertension or DASH diet, which has been shown to help manage blood pressure according to the American Heart Association. The eating plan maximizes fruits, vegetables, and whole grains in your diet. Foods to limit include red meat, sodium, and sweets. So, what is DASH diet? In DASH diet, there are in DASH diet we should take grains 8 to 6 servings per day, lean protein 6 or less servings per day, legumes or nuts or seeds 4 to 5 servings per week. Fats and sweets should be limited. Low fat dairy products should be 2 to 3 servings per day, and fresh fruits and vegetables 4 to 5 servings of each per day. Next is restriction of salt intake. For many people, a low sodium diet can help keep blood pressure normal. The higher the sodium intake, the higher the blood pressure will be. You can cut back on your total salt intake by avoiding high sodium packaged and processed foods and not adding salt to your meals. Reduced sodium intake and the DASH diet substantially lowered systolic blood pressure. Next is exercise regularly. Get moving to prevent hypertension. Physical activity is crucial. The more exercise you get, the better can help control blood pressure. The American Heart Association recommends 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous exercise per week. This should also be supplemented with muscle strengthening activities such as free weights or resistance training 2 days per week. Limit alcohol intake. Drinking too much alcohol can lead to high blood pressure. For women, that means no more than one drink a day, and for men, no more than two drinks per day, according to the American Heart Association. Managing stress. So, stress is one of the most influencing factor of causing hypertension. While the link between stress and blood pressure is still being studied, Stress is known to contribute to other important risk factors for hypertension, including unhealthy eating and alcohol intake. Notes by AHA. Meditation may help you manage both stress and high blood pressure. That is also according to the AHA. So, how can we manage our stress? We can engage in meditation, then practicing breathing exercises, meditations, yoga, listening to music, reading a good book, exercising, taking spa, involving some time in social networking, playing with our pets, etc. By following these practices, we can manage our stress level. Monitoring the blood pressure. Make sure that you have your blood pressure measured regularly, either at doctor's office or at home. High blood pressure often occurs with no symptoms, so only blood pressure readings will tell you if your blood pressure is on the rise. If your blood pressure is below 120 by 80 mmHg, you check it at least once every 2 years, starting at age 20. If your blood pressure is higher, you may have to get it checked more often. Take a look at your lifestyle habits and decide where you can make changes to help prevent hypertension. Conquer small goals such as snacking on fruits and vegetables instead of junk foods and continue to practice these good habits until they are a part of your daily routine. Adopting these lifestyle changes can help prevent high blood pressure if your blood pressure is currently under control, or lead to lower blood pressure if your numbers are already elevated. So, thank you everyone. Always stay fit, stay healthy, maintain a healthy lifestyle, maintain a good balanced diet, and manage your stress. Thank you.